in these moderate and severe lung condition, these people are facing the probability of having to be on oxygen and really losing function of their day-to-day capacities because they just can't move properly because of the severity of their lung damage. So the comprehensive program, we add in laboratory work, and 3 laboratory tests that we run is a basic blood chemistry to get a really nice understanding of how their overall physiology is working based on, you know, their lung condition. So we check their cholesterol and their blood sugar and their thyroid function, their liver, kidneys, all these different lab tests to determine what state of health the individual is really at before they begin treatment. And if any of those things are significantly out of balance, those are things that we begin addressing in conjunction with the SUP AB and LC balancer. Many times, particularly as patients get older and lose function, diabetes, adult onset diabetes is a very common problem that many of our patients walk in with their lung condition. Well, you have to reverse the diabetes so that their body can get blood sugar into the air sacs, so that these air sacs and the alveoli and the lung tissue has the nutrients and raw material that they need to repair well. If they continue to remain diabetic and you try to just reverse this lung damage, it takes much longer. So we do a micronutrient test and we do a food test as well. The food test is designed to determine what foods might be creating more mucus production, more phlegm production, which then makes it more difficult for them to inhale and exhale. We want to eliminate all the triggers in the comprehensive program that might really slow down the recovery process. And the beauty of the comprehensive program is that the recovery process is shorter, even though they have a more severe condition, because they're really identifying these other areas of imbalances that might really impair recovery. And when you get all these right things in place, people heal much more quickly.